Welcome to More Living with Jim Brogan, your source of information for living the best years of your life your way. For more than a decade, host Jim Brogan and his expert guests have come together each week to share important news and advice that can impact the lives and well-being of those who are retired and those nearing retirement. Learn about issues like health and fitness, financial planning, Social Security benefits, investment advice, and more. And now, here's the host of More Living, Jim Brogan.
Good morning, East Tennessee. Welcome to More Living with Jim Brogan, where it's all about living the best years of your life your way. This is News Talk 98.7 WOKI on what is a beautiful autumn weekend. You know, October is one of my very favorite times of the year as the season starts to change. And, of course, we've got college football back in Knoxville, so go Big Orange today. Now, of course, October is a time we really want to focus on women's health. You know, October is Breast and Ovarian Cancer Awareness Month. So really, it's a great month to really think about women's health and discuss it. You know, 1 in 8 women will develop breast cancer in her lifetime. And over 20,000 women in 2020 will be diagnosed with ovarian cancer. You know, we all have women in our lives that we care deeply about, our mothers, our sisters, our wives, our daughters, and our friends. I know women tend to be the primary caregivers, and they often put the needs of others ahead of themselves. And many women put their personal health last on the to-do list. But so many of us depend on the women in our lives, and it's important they take care of themselves. Today on our show, we have Dr. Nilesh Patel joining us again. He was with us last year. He's a radiation oncologist at Tenova, and he's going to talk to us about women's health guidelines, cancer prevention, and much more. Good morning, Dr. Patel. Welcome back to the show. It's great to have you.
Hey, good morning, Jim. Thanks for having me again.
Absolutely. How are things going for you this fall? How are the challenges in your practice with all the COVID-19 precautions? How are things going for you? And what are you seeing on the healthcare landscape?
Well, obviously, we are all facing a whole new, challenges with COVID-19. In our specialty, cancer patients needing radiation, that is not something that can be put off. So we continue to treat our patients, and they still come in to get the necessary treatment for their medical issues. But obviously, given the kind of population that we deal with, high-risk patients, we definitely take all the necessary precautions to keep our patients, our staff, all the personnel involved safe, with masking, social distancing, hand washing, all the things that are needed to try to keep everyone from getting the virus as much as possible.
Sure. Yeah, absolutely. Well, let's dive into women's health. I know that women tend to access the health system more frequently than men, but they also have more routine screenings and exams due to reproductive health. So let's start with routine exams, Dr. Patel. What are the exams every woman should have, and what are the frequencies? Because, that's changed over the years. So talk to us about the guidelines now, and when should women start having screenings?
Sure. So obviously things can change over time as the medical field gets, new data and whatnot. But given that this is Breast Cancer Awareness Month, the typical guidelines, if you look at the American Cancer Society, is typically to begin screening mammograms at age 40. Now, that comes with a caveat because obviously if there is a strong family history, with multiple members being diagnosed with breast cancer, then that can change, the age of when we should start screening sooner. And then obviously in terms of, routine physical examinations, recommendations are for women to do a self breast exam every month just to get a feel of their breast anatomy and to see if there's any change, like a new lump or a new mass they can feel, or just a change in how their breast feels. And then if that comes up, then obviously, go and see your doctor or your physician or your primary care provider just to get checked out to make sure it's not anything more that needs further investigation.
When I was preparing for this, looking at Mayo Clinic, American Cancer Society, I think different physicians even, and certainly maybe even different insurance companies, it seems like some say 40, some say 45. What do you prefer? You just said 40. Is that where you prefer, unless there's a family history?
Yeah, so I think for me personally, and mainly there may be a bias because I see breast cancer patients all the time and treat them. And so sometimes we see younger women, much younger than 40, get diagnosed. So I think at least as long as there's no other risk factors or any other physical manifestations that come up, I feel at least a baseline mammogram at 40 is reasonable. And then depending on how that shows, they may not need it every year necessarily up front. But as you said, sometimes insurance companies may dictate when certain things can happen, which can sometimes put a hindrance on things. So
we're visiting Dr. Nilesh Patel. We're talking about women's health. He is a radiation oncologist at Tenova Healthcare. And Dr. Patel, according to caregiver.com, women provide the majority of informal care to spouses, parents, in-laws, friends, neighbors. We all know that. They play many roles while caregiving. They're a care manager, they're a friend, they're a companion. But you mentioned the importance of self-care. Can you just expand on the importance of being sure, you said monthly doing kind of a self-exam. Just talk about the importance of women's looking internally at self-care when it comes to disease prevention.
Yeah, so that's a great point, Jim. Many times, unfortunately, in our society, we're on the go, always doing things, and like you said, women as a whole are typically the ones that make the house go, keep the family together, and they're so engaged in all aspects of life that sometimes we tend to forget to take care of ourselves personally. And we know in most things, in terms of our health, prevention is the key in terms of making sure nothing gets out of hand. And sometimes we may tend to forget, or not necessarily forget, but not put that as a priority. So obviously, as a patient or as a female, you want to do the things to try to keep your health as optimized as possible. And that includes, things that we always know, diet and exercise, but particularly for women's health issues such as breast cancer, like you said, ovarian cancer, cervical cancer, screening and just being aware of your body are very important things. So, doing regular checkups, like I said, self-breast examinations, regular follow-up with your primary care physician to make sure you're getting the screening examinations like pap smears and things like that, checking on your blood work. Those are all important screening factors. But once again, in this hectic lifestyle we live in, sometimes we may not eat well, we may not eat healthy. So these are all other points that, how to best manage those things so that we can optimize our health.
Yeah, hey, let's talk about diet and exercise. Those are environmental factors. Doctors tend to, seems like, kind of run the whole gamut on what they believe about diet and cancer and even exercise. It certainly seems to me that when we eat more healthy, that means we have less inflammation in the body. It seems like if we have more inflammation, I'm not a doctor, of course, but it seems like if we have more inflammation, that can't be good for the potential for cancer. But some doctors say, no. What do you say in terms of the importance of a clean diet and keeping things like blood sugar under control, triglycerides, to keep the inflammation in our body down? Am I barking up the right tree there?
No, absolutely, Jim. There's actually a lot of really good data that continues to come out that really shows that certain conditions that can lead to, a higher inflammatory state, like you were mentioning, in your body, does seem to increase your risk for cancer in general and malignancy. So we've definitely seen an association with diabetes, obesity, any of these kind of factors that can lead to a higher inflammatory state. So anything that can help control that will automatically help mitigate some of those risks in terms of developing cancer. So we often say that, we just have to keep your diet under good control. Like you said, your blood sugars, make sure if you have diabetes, make sure it's the blood sugars are well controlled. But try to prevent that from happening, right? Make sure you're at a good weight. So all those factors do play a role in terms of cancer development as well.
Yeah, I think we can all learn from that. We're visiting with Dr. Nilesh Patel, and we're going to talk more women's health when we come back. And, the breast cancer 5-year survival rate is close to 100% if it is detected in its earliest stage. So what are some other things that doctors can do to help screen for this disease? So stay with us. We'll also get into other women's health issues as you listen to More Living with Jim Brogan right here on News Talk 98.7 WOKI.
You are listening to More Living with Jim Brogan. During the week, Jim is a financial advisor, an author and speaker with an MBA from the University of Tennessee, who specializes in helping people in or near retirement plan for the next phase of their lives. You can reach Brogan Financial during the week at 865-862-6800 or on the web at broganfinancial.com. And now, here's Senior Market Advisor Magazine's 2011 National Advisor of the Year and host of More Living, Jim Brogan.
Welcome back to More Living here on News Talk 98.7 WOKI. I'm Jim Brogan, your host. You're listening to News Talk 98.7 WOKI, and we're visiting with Dr. Nilesh Patel. He is a radiation oncologist over at Tennova Healthcare, and we're talking about women's health. Of course, October is both breast cancer and ovarian cancer awareness month, and I know the women in our lives, the women in my life, certainly are very selfless. They put, others first, especially my wife. Oh, my goodness. So selfless. But the people we love, the women in our lives, need to take care of themselves. And we're talking about the importance of women's health and catching things earlier. I mentioned there, Dr. Patel, about, that if cancer is caught, breast cancer is detected in its earliest stage, the 5-year survival rate is close to 100%. Now, you mentioned the mammograms that are, of course, the standard for detecting breast cancer. What other tools can doctors use for screening for breast cancer?
Well, like you said, the mainstay in terms of the actual detecting of breast cancer, like you said, is mammograms or some type of breast imaging, which could include breast ultrasound or breast MRI, and those tests could be done based on kind of what's being indicated. Again, in terms of women, what they can do to self-diagnose if there's any potential problem is obviously self breast exam where they feel on their breast once a month just to see if there's any new lumps or hard areas or change in how the breast is looking, or even if there's like a skin rash that doesn't seem to be related to any, contact or irritation. So those are kind of factors that we can look to see in terms of how to detect. But obviously, being in tune just with like family history, has mom or sister or aunts or anyone, been diagnosed with any breast conditions, even benign breast conditions like a cysts or those kind of things that could, lend to possibility of more breast issues down the line. And so if those things are present in the family, that might prompt your doctor to begin the screening process with mammograms sooner than later. So those are things to be quite aware of.
Now, Dr. Patel, some women have certain genetic mutations that have a much higher lifetime risk of the disease. I know close to 60%, I think, of women with what's it called, the BRCA mutation, BRCA, will develop breast cancer before age 70. When should women consider getting genetic testing for mutations like this?
Yeah, that's a great point. Like you said, so BRCA is a genetic mutation that can be seen, and that definitely significantly increases a woman's risk of developing breast cancer if they have that mutation. So obviously this is not something that we screen all women for if they have that mutation, but we do see if there are certain risk factors, such as family history being the biggest one. Are there members in the family that were diagnosed with breast cancer at a young age? Multiple members, a direct relative like your sister or your mother. Also, if there's other types of cancers in the family, such as pancreatic cancer or stomach cancer, if those things are present, that also may make you a candidate to get screening for genetic mutations. So, having a family history is a mainstay in terms of learning about your risk.
Yeah, sure.
Sorry, Jim, to interrupt, but if someone is diagnosed with BRCA mutation, then that definitely changes how we screen. We screen at a much younger age, at a much more stricter interval to make sure we can pick up on those things.
Sure.
And so that definitely would change, how our guidelines would be for those patients.
Now let's talk a little bit as we visit with Dr. Nilesh Patel, radiation oncologist at Tenova Healthcare. Let's transition into cervical cancer. Screening for cervical cancer starts at a much younger age. And it used to be women would be recommended to get a pap smear annually with their gynecological exams. I guess current recommendations, I believe, are every 3 years. Are there any misconceptions about pap smears and their ability to detect cervical cancers?
No, actually, pap smear is one of these breakthrough screening tests that when it has been applied, it has definitely detected cervical cancer at a much earlier stage and has allowed much better treatment when caught early and has improved survival dramatically for women. And because of the ability to detect cervical cancer sooner, you're right that traditionally it had been where pap smears were recommended on an annual basis. But if a woman's pap smears have been negative, then generally they don't have to get screened every single year as long as there's no worrisome findings. With cervical cancer, there's a whole spectrum before you actually get invasive cervical cancer. We often call it precancerous lesions. And so, those things could be detected on a pap smear, and that may require, we need to check this more regularly, like an annual basis. But if those kind of pre-malignant findings are not seen, then every 3 years seems to be quite adequate in terms of screening.
Now, we've had recently the HPV vaccine that's been widely introduced into the healthcare market to help prevent certain strains of HPV that can cause cervical cancer. And it seems it's more recommended for younger women, but even maybe for boys. I mean, what are your opinions on the HPV vaccine? What are the rules of thumb there that you believe in terms of how to use this vaccine effectively?
Yeah, so by far the majority of cervical cancers in women are essentially HPV positive, meaning that the HPV vaccine was a primary driver of the development of that cervical cancer. And multiple studies have come out showing that preventing HPV infection does significantly reduce the risk of developing cervical cancer and, in fact, can prevent it. And so that is something definitely to consider for all young women to consider getting vaccinated against the HPV virus. That can be done in a discussion and communication with your pediatrician, because oftentimes these vaccines are started during the teenage years for women. And so that's something to strongly consider because it is effective. It does help reduce the risk of developing cervical cancer.
Is there an age at which, is it only young women that would get that vaccine?
No, actually we're seeing studies come out that, some women that are older could be candidates for taking the vaccine. But primarily we see that a lot of the data and a lot of the studies have been done in terms of starting vaccination at a younger age. But it's not out of the realm of doing that. And as we get more data, we may see even even continued benefit in older women getting vaccinated as well. So.
Now, how do you feel about teenage boys being encouraged to get the vaccine to reduce the potential spread to their future wives?
So, that's definitely something that's being studied. And, in terms of HPV, like we're talking about women's health, primarily we think about cervical cancer and whatnot, but HPV also is a factor in developing, we call oral cancers as well. And so, men can transmit it to women and vice versa. So that is also something that's being utilized in teenagers, both girls and boys, to help, prevent this transmission of HPV, which we know is a cancer factor.
Vaccines for a lot of people, Dr. Patel, are kind of controversial.
Yeah.
How safe is HPV vaccine? How do you feel about all that? Do you see potential for other cancer vaccines in the future?
Yeah, so obviously, when a vaccine comes out onto the market, there's been rigorous testing. We say phase 1, phase 2, phase 3 trials to look at the safety, the efficacy, and the long-term outcome and risks involved with those vaccines. So once those things have come out on the market, there's a lot of data showing not just the effectiveness, but the safety profile. Now, obviously, can someone have some, unusual effects from the vaccine? That's always a possibility, but the vast majority of people that get a vaccine, don't have long-term problems, and it shows the benefits. Obviously, with vaccination, we've eliminated diseases like smallpox and polio, and so they are effective. And so that is something that, should be considered for all patients that are candidates. And like you said, in terms of for cancer specifically, there's a lot of research in terms of how can we, defeat cancer. And obviously, traditionally, we look at methods such as surgery, radiation, which I oversee, chemotherapy, but also, vaccinations in terms of your immune system, immunotherapy. Well, how can we have your body, just like it can fight an infection, can we have your body fight off cancer or prevent that from even developing? So there's a lot of research looking at these, mechanisms. Can, we use your immune system to be able to fight off cancer, whatever type it may be.
Sure. So for HPV, because, it's kind of scary to think of a 12 or 13-year-old daughter getting a HPV vaccine. I mean, that to me as a father seems kind of scary, but what I'm hearing from you is the benefits are overwhelming as compared to the risks.
Yes, and obviously, you want to have just a frank discussion with your doctor to talk about those things, to learn about, what are the concerns, to voice your concerns, and to have that open discussion. And that's always key so that, you learn and know, what are the benefits, what are the risks. But as we've seen in our data in the cancer field, that it significantly reduces the risk of developing HP-related cancers, mainly cervical cancer.
We're visiting with Dr. Nilesh Patel. He's a radiation oncologist at Tenova Healthcare. We're talking about women's health, and when we come back, we're going to talk about treatment protocol and other lifestyle issues. Also, we're going to have our dollars and cents segment. What is the number one expense you will ever have that you will have over the entirety of your lifetime, and how can you reduce that expense? Because that expense is likely to increase maybe dramatically in the future. So stay tuned as you listen to More Living with Jim Brogan on News Talk 98.7 WOKI.
Through his weekly radio show, television news appearances, and adult education classes taught at the University of Tennessee and Pellissippi State Community College, Jim taps into his extensive knowledge and experience to address issues important to living your best retirement. Join Jim every Saturday morning at 9 a.m. here on News Talk 98.7 WOKI, and visit him online at BroganFinancial.com. And now, here's the host of More Living, Jim Brogan.
Welcome back to More Living with Jim Brogan, where it's all about living the best years of your life your way. This is News Talk 98.7 WOKI, and October is one of my favorite times of year. And boy, what a beautiful fall weekend we're having here. Hopefully our Tennessee Vols will pull us on to victory. We're visiting with Dr. Nilesh Patel. Of course, we're talking about women's health. He is a radiation oncologist at Tenova Healthcare. Of course, October is Breast Cancer and Ovarian Cancer Awareness Month. So we're going to get into more great stuff with Dr. Patel. Before we do get back to him, however, it is time for Dollars and Cents.
Want to be sure you are getting the most out of your retirement? For all the years of your retirement? That's That's the primary goal of More Living with Jim Brogan and our Dollars and Cents segment, where we provide you with an important financial tip that will help positively impact the quality of your life in retirement. And now, here's Jim with this week's Dollars and Cents tip.
What is the number one expense you and I will ever have over the course of our entire lifetimes? It's not your health care. It's not your house. It is your income taxes. And it's really not even close. Income taxes are far and away the greatest expense we have. Now, the good news is, in retirement, we typically have more control over our income taxes than at any other time in our lives, especially in the sweet spot between retirement age and age 72. Now, why 72? Because that's when you have to begin those required minimum distributions from your IRAs, 401ks, and other retirement accounts at a clip of about 4% per year, roughly. So you've got to start paying income tax on that money. And now, many people throughout their 70s and 80s have great tax planning opportunities. But the bottom line is, most people that I talk to in my office, and even that attend my classes at the University of Tennessee and Pellissippi State Community College, have a tremendous opportunity to impact their tax bill. And tax planning is very, very different than tax preparation. You know, every year in the spring, typically, we do our tax preparation with our CPAs. But that is looking into the rearview mirror. We're looking at numbers that have already been generated, and there's nothing we can do to ungenerate those numbers. Tax planning, to the contrary, is looking forward and being very intentional about the income taxes that we pay. You can be extremely intentional in terms of how you draw income, where you draw it from. Your Social Security strategy can affect your income taxes. How you invest your money. Certainly, your non-IRA investments can have an impact on your income taxes. So a lot of that can be very intentional. Many people we work with can realize 0% gains on long-term capital gains with effective planning in the early years of retirement. And, you know, if you're close to retirement or in your retirement and you don't have a tax plan, you need to get one. It literally could mean hundreds of thousands of dollars throughout your retirement. You know, our country is spending money like never before. And there are a lot of parallels between what we're doing to spend money with the pandemic versus World War II. And if you look back in the 50s, highest income tax rates were over 90%. For 18 years, income taxes, the highest tax rate was over 80%, and most of those years after World War II were over 90%. And they were as high as 70% in most of the 80s, all the way from 80 to 86. So you don't want to be caught off guard. At Brogan Financial, we build tax strategies into retirement and investment plans designed for you to keep more of your gains. So don't be caught off guard. Be sure you have a tax plan. If you would like a tax analysis, we can do that either virtually or in person. Give us a call at 865-862-6800. Again, that's 862-6800, or visit us online at broganfinancial.com. We are happy to give you a complimentary tax review and show how you could impact your tax bill over time to the tune of maybe tens of thousands of dollars.
That's our Dollars and Cents segment for this week. You can find this week's Dollars and Cents segment and others by visiting broganfinancial.com.
Please do check us out at broganfinancial.com. You can sign up for our weekly e-newsletter where we keep you informed. All we do in the e-newsletter is provide links to content that we've generated for that week. And I have to tell you, I've got a report that I have just written and published, and it'll be coming out later this week. The election, federal stimulus, and the stock market. You definitely won't want to miss that report that I'm publishing. And again, it'll be out later this week. But you can go onto my website, and if you sign up for our e-newsletter blast, then you'll be notified as soon as we have that article ready. You can also follow us at Facebook There's links on our website, again, broganfinancial.com. You can also find out about our future upcoming classes. We also have some great resources on the website. If you click on the resources tab, we got some short video blogs, 4 or 5 minute tips of how you can be successful in retirement. Today we're talking about women's health. The women in our lives are so important to us, and oftentimes they don't make themselves the priority. They're so focused taking care of their kids, their husbands, their parents, their in-laws, and they need to take care of themselves. So we're talking about the importance of women's health with Dr. Nilesh Patel. He's with Tanoba Healthcare. He's a radiation oncologist. And let's talk about ovarian cancer. There's not a screening test for ovarian cancer, to my knowledge, Dr. Patel. What are the signs and symptoms of ovarian cancer, and how can women protect themselves?
Yeah, unfortunately, you're right. There's not a good screening test for ovarian cancer, like mammograms for breast cancer or, colonoscopy for colon cancers. But generally, in terms of ovarian cancer, because there's not a good screening test, a lot of times it's diagnosed at a later stage. Typically, the symptoms you worry about are, abdominal or pelvic symptoms such as pain or bloating, a change in bowel habits, nausea, and then obviously anything really dramatic like, vaginal bleeding, especially postmenopausal bleeding. Those are all things that need to be, checked out as soon as possible.
Yeah, so just being in tune to what's, as you said earlier, what's
right.
going on with your body, right? Now, you're
exactly.
a radiation oncologist, so less invasive technology and targeted therapies are constantly being studied and are becoming more and more attractive. What are some of the new treatments out there for breast, cervical, and ovarian cancers?
So in terms of, breast cancer itself, generally, the mainstay in terms of treatment is either a combination of surgery, radiation therapy, or chemotherapy, depending on the stage of disease. Typically, for early-stage breast cancers, the first step is removal of the primary tumor in the breast, and that can be done either with what we call a lumpectomy, which is just removal of the tumor, and then you preserve the breast, or having a mastectomy, which is, surgically removing the entire breast. And then typically women that undergo breast conservation, where they just have the lumpectomy alone, then we will offer radiation therapy typically after that, mainly to reduce the risk of breast cancer coming back in that breast. Like you said, as advancements have happened, surgical techniques have improved where, typically in the older days, most women would undergo a mastectomy, but now we can often preserve their breast with a good cosmetic outcome, even in women that we may recommend mastectomy because they may have, like we touched on earlier, the BRCA mutation, or they have a large breast cancer and you just cannot preserve the breast. Reconstruction has allowed, women to kind of have a new breast after their breast cancer treatment and feel whole again in that sense. And then in terms of radiation therapy, we've come a long way in terms of how we deliver radiation treatment with less side effects, less target area, essentially. Before, you often had to treat the entire breast for over a 6-week period, which would be once a day over that time frame. But then as techniques have improved and indications have changed, women with early-stage breast cancer, we can often shorten their treatment, sometimes up to 1 or 2 weeks, and be very focused just to the target area. And so that leads to less side effects, less long-term problems and issues. So as we continue to learn and as things evolve, our treatment techniques continue to improve, and we can lead to better outcomes for our patients. So.
When you talk about radiation therapy, talk to us a little bit about the difference in the traditional delivery of the radiation versus using proton therapy to deliver the radiation, because certainly proton therapy has become very, very much talked about in the ability to isolate tumors and have minimal residual damage. Can you compare and contrast a little bit the strengths and the weaknesses of those two treatments?
Sure. So when we talk about traditional radiation therapy, generally what we're using is high-energy X-rays, kind of as the medium that will deliver the radiation to the target area. And proton therapy is doing the same kind of thing in terms of delivering radiation, but instead of utilizing X-rays, it's utilizing proton particles. So they're both invisible beams being delivered to a target area. In theory, the proton therapy was felt that could it be a better treatment because at the end of that beam, typically there's a sharper fall off. So the thought was, could that reduce, exposure to the normal tissue? But if you look at compared to traditional radiation, that would be the case. But X-ray therapy has advanced, particularly over the last 10 years, in terms of how that technique is being delivered. If you do research on it, there's techniques called IMRT, called intensity modulated radiation therapy, VMAT, called volumetric arc therapy. And these are all advancements in terms of treatment delivery where X-ray radiation, or photon radiation, we call it, has significantly improved in terms of sparing the surrounding tissues. So a lot of times, if you compare proton therapy plans and these modern X-ray radiation plans, there's not a lot of difference in terms of how the plans look and in terms of side effects. But yes, you're right. There are definitely indications where proton therapy may be a better choice. Certain spine tumors, certain brain tumors, a lot of pediatric tumors in kids, those are indications where proton therapy may be a better choice. But for the vast majority of cancer diagnosis, modern X-ray radiation techniques are very effective with great outcomes and less long-term side effects than previously before.
And I guess the medical technology development, Dr. Patel, I guess, I don't know this. You can touch on this. I've heard this, but the protocol today versus 5 years ago is just exponential improvement from what I've heard. And then what will that be over the next 5 years? I would guess that we would continue to see tremendous innovation in treatment of all cancers.
Right, and it's always hard to know and hard to predict in the future. But just like 5 years ago, what our smartphones could do and what our smartphones and our iPhones can do today, it's just amazing, right? We literally have a computer in our pockets all the time. So the same thing with medical treatment, cancer treatment, as innovation and technology continues to push forward. We're going to see better treatments, newer treatments, and even traditional treatments will be improved upon so that we can try to eliminate the cancer and then minimize side effects so that our cancer patients can have good long-term quality of life after they've defeated their cancer. And so that's the ultimate aim. We just don't want to. Yeah, absolutely.
Yeah, that's absolutely what it's all about. We're visiting with Dr. Nilesh Patel and talking about women's health here in Breast and Ovarian Cancer Awareness Month. He's with Tenova Healthcare, radiation oncologist. When we come back, we're going to talk about the lifestyle impact, the emotional side of it, and resources here in Knoxville that can help you. So stay tuned. This is More Living with Jim Brogan on News Talk 98.7 WOKI.
Thank you for listening to More Living with Jim Brogan. If you miss any of today's show or want to listen to it again, visit broganfinancial.com, where you can access the podcast and other educational materials to help you in your journey through retirement. And now, here's Senior Market Advisor Magazine's 2011 National Advisor of the Year and host of More Living, Jim Brogan.
Thanks for tuning in to More Living. This is News Talk 98.7 WOKI. I'm Jim Brogan. We've been visiting with Dr. Nilesh Patel about women's health. He's a radiation oncologist at Tenova Healthcare. He's been very, very generous with his time. Always great to visit with Dr. Patel. Do check us out online, broganfinancial.com. We archive all of our shows. You can podcast those shows right there at our website, broganfinancial.com. Click on radio. Also, if you click on the resources tab, we have a brand new page called Brogan University, and it is 3 to 5 minute videos on various topics. Things like reducing taxes in retirement, how to provide stability of income in the short term in volatile market conditions, with growth of income in the long term to fight inflation. It's all kinds of great topics. You can also sign up for our e-newsletter. to stay informed of when we post different videos and research reports. Dr. Nilesh Patel, let's talk about the emotional side of this. You know, cancer, regardless of your age, can be very scary. And if you get diagnosed, you know, how does your mental state, Dr. Patel, impact how you respond to treatment? Can you talk a little bit about the tidal wave of emotions and how you sort through that to attack it in the right emotional state in a challenging time?
Right. So obviously, the cancer diagnosis itself can be just the devastating, information that you receive, and it can be overwhelming, and that's quite natural. You know, first of all, the women that I treat that get diagnosed with breast cancer and they come and get treatment, it's perfectly natural to feel these wave of emotions, overwhelming in terms of why me, or denial, how is this happening, or why did this happen to me, or is this really going on? And then ultimately having to navigate the whole process of your treatment. What do you do first? What's surgery going to be like? Radiation, how's that going to be? What kind of side effects or what kind of issues come up from that? Chemotherapy and all the things that come along with those treatments. So, obviously physically your body has to endure those treatments, but the emotional part and the mental state is a huge deal in terms of how women get through all this. And so just from my own personal experience, what I've seen is that women that seem to have a great support system, caring family and friends that are going to be there for them and provide that emotional support, they're just able to handle things better. Obviously, it's easy to say, but having a positive mindset and trying to tackle this on and saying, look, we're just going to give it our best effort and, really try to overcome this versus really allowing the diagnosis to overwhelm you and thinking that, oh, my gosh, this is going to end badly. No, having that positive mindset helps women have that strength to get through these treatments. And, like I said, even though we've made a lot of advancements in terms of our treatment, there's no doubt these treatments can be difficult and hard, physically as well as the emotional toll. So having that great support system, having resources, and even just educating yourself that, sometimes people hear, oh, I have to have radiation or chemo, and they hear all about the terrible possibilities or older family members that went through it. And then, like I said, today's treatments are so much better than what treatments were 5-10 years ago. So sometimes just, learning about that can help alleviate some of the angst and concerns.
Yeah, and I think this is one of those things where, if, the internet can be, very informative, but we also need to have a little bit of a filter because, when you get online and start reading things, it can really be overwhelming and scary. The reality is, as you said, the support network, with 1 in 8 women will get this disease, most of us either know somebody who has dealt with it or will deal with it. And so we can provide tremendous support. From my vantage point, I just want a quick word. I don't know how I would get through something like that without my spiritual foundation. So, certainly prayer and all those things are also, I think, critically important. Dr. Patel, unfortunately, we're out of time. How can people get hold of you if they want more information about your practice or about potential treatment?
Yes. So, my practice is Premier Radiation Oncology, affiliated with Tenova Healthcare. We have a website at www.tenova.com, and our office number is 865-218-7081. So we are more than happy to help out anyone in need in terms of cancer education and helping navigate through the cancer process.
Well, Dr. Patel, thank you so much for your time today as we've discussed a very important issue with women's health. Thank you to Chris running the board. Thank you, Jill, producing the show as we've discussed women's health, because greater health provides for more living so you can live the best years of your life your way. Thank you for tuning in. This is News Talk 98.7 WOKI. Have a great weekend.
The views expressed by Jim Brogan and his guests are not that of Cumulus Media. Any discussion of financial, legal, and tax planning strategies is not intended to be individualized advice and is general in nature. Always consult with your advisor for advice specific to your needs. This program's content does not represent a recommendation of any particular security, strategy, or investment by Jim Brogan or Brogan Financial Incorporated.